Traditional methods of finding the fertile window typically rely on just one measurement per day. This single snapshot often misses the big picture of what's actually happening during your cycle. In reality, your hormone levels fluctuate in 24-hour rhythms, particularly during the follicular phase of your cycle, which is the phase prior to ovulation. Your core body temperature rises and falls with these hormonal changes, and when measured regularly, predictive patterns emerge that can indicate events such as impending ovulation during your cycle. By continuously measuring your core body temperature rather than measuring it once per day, Priya's app-based algorithm detects these patterns to more precisely predict your fertile window. OPKs typically work to identify a surge in luteinizing hormone with a single urine test per day. This surge can often occur less than 24 hours prior to ovulation. If you take the test at the wrong time, you may entirely miss your fertile window. On average, Priya notifies 4 days prior to ovulation, giving you and your partner more time to have intercourse when you're most likely to get pregnant. After you ovulate and enter your luteal phase, progesterone increases and causes a detectable rise in temperature, indicating that ovulation has occurred. The Priya app will send you an alert to confirm ovulation.
In the 004 study, approximately 50 cycles, and in those patients, they were able to adequately pick up the patient's core body temperature with the Priya sensor over 97% of the time. They also adequately predicted ovulation 2.7 days prior to the prediction of the LH surge. So a greatly increased planning time for patients to know when they're going to ovulate, when they'll be able to be together to work on conceiving. In the current study that we're doing, the 006, we're comparing the previous methods that women used to predict ovulation, them evaluating their own cervical mucus, doing home urine LH kits, and then adding in vaginal ultrasound and now predicting and tracking ovulation on ultrasound and comparing that to the Prima-Temp results. Probably the most exciting finding in the study so far is we had 2 patients who did not have LH surge and would have assumed that they didn't ovulate that month, and yet based on the ultrasound and on the Priya sensor, we documented ovulation. And so it's evidence that it's going to be superior to the LH surge, which isn't too surprising.